What is it about Bella Hadid? What is it about this name, this celebrity, that so captivates everybody? Hi, I'm Dr. Jonathan Zelken, board-certified plastic surgeon, and today I want to discuss a recurring question. Did she have plastic surgery? Why is she so beautiful? And can I have what she has? And let me start by framing this by looking at a picture of Bella Hadid. She's about 24, 25 years old. She's got very, very pretty features, clearly. She's made up in this picture, of course. And some of the key assets that I like about this picture, which doesn't really appear touched up to me, is that the outer aspect of her eyebrows is taller than the inner aspect. I think that's always an attractive feature. She has an arch, and it's a little asymmetric, and it's peaked, but it's not too peaked. That's really attractive as well. Her eyes, the lower eyelid in particular, has a little bit of what we call an mongoloid tilt, meaning that the lateral canthus is just higher than the medial canthus. She goes on to accentuate it with makeup, and that's one of her signature looks. She also has this white space under her eyebrow, which shows this sort of youthful fullness underneath the eyebrow. When you put all this together, it's really attractive. Keep these concepts in mind. Her lower face is really attractive too. The mouth is about 1/3 of the way down between the nose and the chin. Her cheeks are full, but not too full. They make her eyes look big, like that perfect in between. She's got a gentle hollowness in the cheek. It's not exaggerated, it doesn't look gaunt, but it really accentuates her cheekbones and her jaw. All of these features are absolutely gorgeous, and she does not look operated on to me, with the exception, perhaps, of her nose. If you look very carefully at her nose, there's a sort of an irregularity or an incongruity. If you follow this gentle curve from the eyebrow down to the tip, I can imagine if I were examining her, I would feel a step off. You can even see this inverted V where the bony vault and the cartilaginous component of the nose don't line up. This is called an open roof deformity, and it is a complication of rhinoplasty surgery. So I would say, based on this picture alone, let alone her befores and afters, which we'll get to, it's pretty clear that she's had a nose job. Everything else about her, especially since she insists she's never had surgery, is plausibly natural, especially her lips. Let's talk about this open roof deformity. A sign of, in my opinion, a telltale sign of a bad nose job is, for example, somebody who's over-resected here and no osteotomies were performed here. So you've got this wide nasal bridge and then you've got a narrow tip. If that happens and this inverted V arises, it's a telltale sign of either a bad rhinoplasty or something else like previous trauma, maybe cocaine abuse, maybe something called Wegener's granulomatosis. We'll save that for a different discussion. But this is what I'm talking about. This is why I think she's had rhinoplasty. In comparison, someone like Mona Lisa, who, like Bella Hadid, seems to garner the attention of masses over centuries, also has similar features. Look at her eyebrow to her nose. Even though there's some cracking of the oil-based paint, you can see a gentle curve that's not disrupted. She hasn't had rhinoplasty. But she also has this beautiful shadow in the corner of her eye, which is such a unique feature of Mona Lisa that I think Bella Hadid, either intentionally or unintentionally, is recreating with her eyeshadow. She has a gentle mongoloid tilt where the outer canthus of her eye is about 1 millimeter or 2 higher than the inner canthus. Can't really see her eyebrows here, but that's secondary. She has facial features otherwise which are very similar to Bella's, with the exception of a little bit more volume and fullness, which I'm sure was attractive in her time. So let's look at two pictures. Everyone's saying she must have had tons of plastic surgery. I want to look at this picture in particular. This is the one that my nurse sent to me and said, explain this. When I look at these two pictures, I see more evidence of manipulation of a photo and airbrushing than I do of surgery. Her lips are very consistent before and after. Her eyes are very consistent before and after. Her eyebrows are a little bit elevated here. That could be makeup, it could be microblading, it could be surgery, but I don't think so. I think there's so much going on here, including softening of this open roof deformity, that some of the unrealistic aspects are a very pointed chin, very white sclera of the eyes, and smoothing of the imperfections of her nose that make this before and after probably more attributable to Photoshop than to surgery. I also wanted to make note that this patient was 14 years old and either peri or pre-pubertal in this picture, and she is now a model who is very thin and gaunt, walking on runways in this picture. So is this surgery? Or is this just aging and a normal, natural weight loss associated with it? I think she's very beautiful here, but I don't think this picture is all her. I think it's more Photoshop. This reminds me of one of my favorite TV stars, Candace Cameron Bure, who, as DJ Tanner in Full House, had like a perfectly circular face back in the 80s, and now she has a much more elegant and sort of V-line. I don't think she had surgery. Folks, this is aging. This is the puberty process, and this is natural slimming of the face. So let's get back to the subject at hand, Bella Hadid. This is a picture of her that looks a little bit startling that I've seen recently. If you compare this to her old picture, yes, she's had work done to her nose. You can see imperfections of the bridge here, of the bony component. Her eyes are squinting and smiling here where they're more at repose here. So there are certain things about this picture that are different. The lighting's different, the makeup's different. I don't think this is filtered. And it's possible that she's had maybe a thread lift or something to bring this sort of unnatural sweep up under her eyes. But it's also possible that that's just her animating. Let's get back to Mona Lisa. Bella Hadid, I think, is our new Mona Lisa. I think there's something about her that captivates both plastic surgeons and the general population alike. Plastic surgeons as artists want to try and recreate some of these subtle cues and features that make somebody so pretty. And some of the most stunning similarities are the eye shape, this shadowing, which is recreated by Bella's makeup, and the overall facial proportions, including a short nose to lip distance and fullness in the cheeks and the jawline with a gentle shadow in between, which subtly recreates the appearance of a smile even at repose. These are my thoughts. If there's somebody that you're itching to wonder about and you want to ask a question, what happened to this person, I may be able to weigh in either by responding to your comment below or by making a new video. There's some people that people have been asking me about that are on my mind. Make sure you subscribe if you want to learn more, and these are just my musings and my thoughts.